Today's speaker is Dr. McCandless from McCandless Chiropractic. He has been a chiropractor now for 7 years. He's located on Clint Drive. He is not married, doesn't have any children, but he does have a pet rock named Pete. His hobbies include working out, anything with sports, and he has a newly found passion for ping pong. He lives in Grandview and has been there for 4 years. His burning desire is to help Cass County families achieve their health care goals. Something no one here knows about him, he just started taking guitar lessons. His key to success is God, faith, and hard work ethic. We welcome Dr. McCandless.
Good morning. I always enjoy getting to come back and chit-chat with everybody for a while. And one thing, we're going to talk about 2 different things today. The first one is something that comes around, it's kind of cyclic, it seems to be, and I kind of mentioned it during my 30-second presentation. I've noticed recently more people talking about kind of being scared to go to the chiropractor. They're worried about getting their neck twisted off or broken with the adjustment, or getting turned into a pretzel and jumped on. Which that is a valid technique. It does work, and there's a lot of research to prove that. But about 3 years ago, I started utilizing technology more to my advantage. The technology I use now is the computer that you see, and we're going to give an example of that, how it works and how it's different than the old-fashioned hands-on method. But first, I'm going to just kind of show you what I used to do. So, Brenda, if you can come up here for a moment. The research shows now that using my hands to find a bone that's stuck is only about 50% accurate. It means I might or might not get the exact one that I need, but over time we're going to fix the problem. What I do for hands-on adjustments, because I'm short, is I have trained my hands to find areas of the spine that are not moving well. I used to put a piece of hair underneath the page of the phone book and rub my finger over it until I could find it, and I'd add pages to that and keep feeling for the hair. And I can't remember what I was up to. There was a lot. So my hands are very sensitive. So, and is that tender there? Yeah. So then there's a spot that's locked in Brenna's upper neck. And so what I used to do is I used to go in, and then I used to actually move that. And that moved very well. But a lot of people say, I am not going to have that done. It can be very, very worrisome for some people. So what I did.
Brenna looks calm as calm could be.
She's not going to work later, is she? Too relaxed. Okay, you're right. Well, maybe you stand right there for just a moment. So what I found is some technology that moves the bone just as much as a hands-on adjustment. Research shows it's actually moving the bone more than a hands-on adjustment. But it can be very gentle at the same time. And it's accurate up to 85 to 90% on finding the bone that needs the help. So if there is a current patient that wants to volunteer, I will. And President is getting priority. I talked to him before the meeting and asked if he wanted to. Go ahead and just kneel down like your chair. You can actually put your under that. Is that position okay for you?
Yeah, that's perfect.
So the new technology that I use, it is very gentle, and what happens is this computer has a handheld device that you can see here. Inside of it, there's what's called a piezoelectric sensor. That sensor's job is to actually measure the motion of the bone. So instead of using my fingers to find the spot that needs help, which there's one there, but and this goes in and puts a small tap into every bone. The computer reads that tap and then tells me on the screen which bones need help. So I'm not guessing. It's actually just finding the ones that need the help. I then get to go in and pick out the ones that are having a problem, put it on the pounds of pressure that I think is appropriate to move that bone properly.
You're messed up.
And then I get to put it right onto the bone. And that's actually doing the adjustment. And every tap that Alex feels, the computer is remeasuring. And it only stops the treatment when it's measured that we made progress. So you're never over-adjusted, you're never under-adjusted, you get what your spine needs every time. There's one more spot here. And what I love about it being so objective, so there's no guesswork, I get to go back, remeasure the same area, and make sure that I did make progress, which in his case I did. I then moved down to the mid-back. And do the same thing. I'll get to pick out the ones that need the most help. I'll pick the top 2 pounds of pressure I feel is appropriate. Go back to that spot. And we have a lot of stress between the shoulder blades and the upper neck. Did you say you feel that as well? Yeah. So that one took longer because it took the computer a little bit longer to move that bone into a proper position. Then I would go back and remeasure. And then what I also do, and this is where some chiropractors I feel fall short at times. I think it's very important to not only move the bone, but then to also work on the musculature around that spot to make sure tight muscles aren't trying to pull the bone back out of position again. So for adducts, I'm going to choose a protocol that I know works very well for the mid-back. And we're going to work on the rhomboids and the trapezius muscle. And it's not just randomly clicking. It actually is set up to a frequency which has been proven to relax muscle. So it's not like you're just getting a little massage. It's actually taking a muscle fiber. And just like you would reboot a computer, if your computer crashes and you have to reboot it to get the computer to work properly again, I am rebooting the muscular fibers to be more relaxed again and not so stressed out. So it's actually helping to calm down those muscles. And that is how the Pro Adjuster adjustment works. Thank you for your help. I appreciate it.
Thanks.
I feel a lot better. Just leave your copay on the table.
Right. Do I still do hands-on treatment? Yeah, sometimes I still have to. Not very often. Do I still have patients that want to be cracked and popped? Yeah, I still get that as well. And there's several different techniques that a chiropractor can use. I use 3 main ones, but this one is the one that I use most common nowadays. So if you do find that person who is worried about going and getting adjusted, let them know that you have a chiropractor that can very gently find and correct the subluxation or problems in the spine without having to get on the top ropes and jumping on them, right? And there's one other thing that I have found, it's coming back around again. This used to be more common, and I study the research. I feel like it's very important. If you're going to be in a profession that is kind of, people look at us and they say, are you really doing what you say you're doing? And I get a lot of skeptics. It's just how it is. And so I do follow the research, and this profession's been around for over 200 years, and now there's more evidence-based research to prove that we are doing what we say we're doing and that it's very effective. And one of the recent ones that came out I want to share with you because I feel it's very important. And this was a study that was done over a 3-year period, and it took a group of senior citizens, so it was 75 and older. And in this group, they had half of them that were under what they call preventive chiropractic care. Think about that. They were getting a once-a-month preventive adjustment to find problems and help correct them before they hurt. And then you had the other half that were not getting any type of chiropractic care. Okay? After a 3-year period of doing that, they found that seniors who receive chiropractic care spend fewer days in the hospital and nursing homes than the elderly non-chiropractic patients. Senior citizens under the chiropractic preventive care report better health overall, had fewer chronic conditions, and were less likely to use prescription drugs than the non-chiropractic patients. 87% of the senior citizens under the chiropractic care described their health status as good or excellent compared to only 65% of the non-chiropractic patients. And chiropractic patients spent 15% less time in nursing homes and 21% less time in hospitals than non-chiropractic patients. Preventive care is for everything, right? I go get my teeth cleaned to make sure I don't get cavities. If we find cavities in the spine, extrapolate that. That's a group of 75-year-olds or older. What if we started being preventive with our spine at 20, 30, and 40? Then what type of results are we going to have? Why are we so trained to only get our spine checked on when it's such a pain and the problem's already there? And this is just showing that, man, if we do preventive care for our spine, we can stay healthier for a longer period of time. So keep that in mind. It's not just for pain, but also for just overall health. So again, I thank you all for allowing me to come and talk to Dr. McCandless with McCandless Chiropractic Body Works.